Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's a fall day outside. It's bright, it's sunny, it's chilly, but you know what? We're here and we're ready to give you some very interesting information. Perhaps you've had a problem, you've tried, you've applied. Well, this is an opportunity, as always, to find out how to fix it without drugs, without surgery. You know, life is the way you create it. Your body is one of those situations that health is a do-it-yourself program. You've heard that 1,000 times from me. Well, we're going to talk about a subject today that is really about that. See, you are supposed to be, you know, you come into this planet, you come in at 100%, burning brightly, and then over a period of years, that kind of light goes out and you're no longer here. But in between, you're not supposed to kind of sputter and wane and wax and, you know, that kind of nonsense. But having said that, 888-630-9625, that's 888-630-WMAL. We're going to talk about an interesting topic, one that most guys want to put their heads under the pillow and hide from because they don't believe it's true. Not me, Lucy, can't help it. But in studio, to help me do it the right way, Dr. Scott Lamb. Good afternoon.
Good afternoon, Tom.
We're going to talk about male menopause, also known as male andropause. It's when guys end up with hot flashes and sweats and no energy and really don't work anymore. That's the menopausal transition. Yeah, I told you I was going to say that, right?
Yep.
So here's the deal. Guys, you know, it happens to so many of you, and the problem is that it happens at younger and younger ages, where libido goes out the door, muscle mass doesn't grow like it's supposed to, you get cranky, you get short-tempered, you sweat at nighttime, your mind kind of drifts off. You know, all the symptoms that your wives complain of as they're going through the transition of menopause called perimenopause, well, you guys do it too. Unfortunately, none of us, whether it's women or men, should go through the process. We should have a very strong and vibrant life, and our hormones should maintain themselves at some point of our lives. You know, they kind of weaken down a little bit because you don't want to have the drive you did when you were 13, 14, 17, 18 years old. That would be out of control. You'd never accomplish anything. You know, Scott, that reminds me of a book when they interviewed Jack Welch, the old CEO from General Electric,
yep.
And they asked him, said, you know, because he had a history of doing a little womanizing and so forth, and they said, Jack, you know, do you have that drive that everybody's accused you of, and you know, that need to have a woman around you all the time? And he said, thank God, no, I never accomplished anything in my life. So, you know, once you get to a place where your frontal lobe is more developed and you understand consequences and the hormones start, but the point of it is they shouldn't crash. All kidding aside, putting the jokes in our back pocket, the bottom line is that guys go through this transitionary process like women do, but unfortunately we don't recognize it and we don't take any action. And we're going to talk about some of the same things that happen to women that are happening to men, but environmentally in today's society, the impact is even more so. And there's a whole movement out there right now talking about something called the vanishing male, which is something you're going to talk about. Dr. Scott Lamp, my guest in studio, will be your host this Wednesday evening. The 27th, no, that's not the right date, the 7th, I'm getting dates mixed up. The 7th of November at 7:30 p.m., he will be your host, your presenter at the Roselle Center for Healing for our in-house continuing education program. These are designed for you to learn, to apply, to fix things. And all we require is a reservation, because without that, we're going to tell you, guess what, can't come, because we fill up very quickly for most of these presentations. If you'd like to attend Dr. Lamb's presentation this week, 703-698-7117. That's 703-698-7117. So let's talk about it a little bit. Let's talk about what really is. I touched upon it a bit, but we see a lot of it in the office in many different conditions. But what really is male menopause?
Well, menopause is like you're looking at testosterone is the big thing that you think about or you hear about, and basically the testosterone number starts to drop with age. But the thing is with the aging process, like you were talking about before, things start to we start not having as much power in that or making that particular hormone as easy as we had in the past when we were younger. But there's a lot of other factors that play a part in it. And again, there's nutritional deficiencies, there's structure. I mean, let's go back to that triangle we keep on talking about, you referring to, Tom, is that the triad of health. There's going to be structural components to that. There's definitely chemical components to that, and really a lot with the stress mechanism out there too. That plays a lot too, because that can steal away a lot of our youth, just the aspect of stress. So there's a strong emotional component.
Well, let's talk about really what the presentations are. I mean, we touched upon a little bit. We're talking about, hormones going down the tubes and loss of sexual interest.
Right.
Libido, it's gone.
Libido, energy levels, can't get up in the morning. I mean, you got some of these aspects. My memory starts to affect. This is going to affect brain tissues to some extent. My vitality, how strong are my muscles, be able to build myself back up again. Those are things you're going to see being depleted here.
Male menopause is a real deal. In medical, it's interesting that when medicine doesn't understand the physiological paradigm, they begin to poo-poo things.
Right.
It's all about the ladies, it's not about the guys. Well, the truth of it is, it's about both of us, and for many similar reasons, and particularly with men. Years ago, I'll never forget it, I was actually going back, way back, when I was in the clinic in school. I had this truck driver, and he came in, and we were treating him for low back pain. And this guy was this very gruff and burly guy, and he had pain in his legs and so forth. And he said, that he was a long haul guy. He would go from New York to L.A. and back and so forth. And so anyway, we started treating him, and his back pain was going away. He was feeling much better. We gave him exercises to do. And this one day he came in and he says, "Hey, Doc, listen, I got a question for you." I said, "What's that?" And he looks around to make sure the door was closed, and he said, "Could this my back pain have anything to do with my inability to perform sexually?" You put it in different terms. I'm just being kind today.
Right.
And I said, "Yes, absolutely why?" He says, "Well, things seem to be a whole lot better, and I was having some real problems." So it can come from the back.
Right, it comes from the back. Another one, there's people that go up the utility poles, and sometimes where the belt hits, and sometimes it hits and pushes on certain types of nerves, or where your back gets injured. That's the structural component. You have to have communication from the brain to the parts of the body, and if they're compromised, then some things can get altered, not function, get disrupted, don't work.
Yeah, we don't look for functional breakdown. We look for pain patterns and physiological or physical incapacities, but this is one that is directly tied into that. And by the way, for women as well, more so with guys, because they're doing all these jobs out there. They're bulls. They're on the streets. They're in construction jobs, or they're working around the house. They're lifting the lawnmower. All of that can have an effect. So we know that structurally that there can be a physiological problem.
And I think one of the things to talk about, when we talk about the irritation, if we just go on the structural component of a nerve, 10% of your nerve goes to pain. What the heck does the other 90% do?
Yeah, it's all function.
It's all function. So if I want to have if I have a pain there, you're going to guarantee you're going to have a dysfunction of some sort to wherever that nerve goes to.
A lot of things I will tell patients in describing how things break down the body neurologically. I said, you have an input, and obviously this is just describing, and it's not physiologically necessarily accurate, but you have a wire coming into the house, and it goes into a dimmer switch. And your light's working, but you notice it's not full bright. And it's because the dimmer switch has been dampened to decrease the flow of electricity, and same thing's happening in the body. If the nerves coming from the spine are dampened because of pressure, overstretch, irritation in some way, then that target, in this case what we're talking about is male genitalia, aren't going to work the way they're supposed to.
Right.
And it can be strictly structural. But let's talk about the piece, and we're going to get back to structure a little bit. Let's talk about the piece that medicine likes to talk about, the biochemistry.
Right.
You see it in television today. All the commercials are out there for Viagra and Cialis and so forth. And they're they're positioning it not just to older guys, but they're positioning it to guys who are in their 30s and their early 40s. And because things aren't working the way they're supposed to. So let's forget about the fix for a minute and ask the question, why? What's going on?
Well, in that particular instance, you're talking about there's something called nitric oxide. And so basically this is just a chemical that helps increase blood flow. And so what happens is we have enzymes in our body after a certain period stop that nitric oxide. So a lot of your Viagras and those type of drugs are looking at trying to stop that enzyme, continue the flow. The problem is why is the flow impeded? And what are we doing to create that problem in the first place? And that's some of our habits that we do, some of the foods we have. One of the things we're going to take a look at is how altered if we have blood flow problems, if we have a lot of varicosities in our legs, or even on the testes themselves, if they have a lot of varicosities on it, then there's a blood flow problem there. Now, you can force it by medication, what happens with it, but the underlying, if you really want to cure something or take care of something, you got underlying things that we're doing here, and you'll notice things like people who are diabetic, people who have high blood pressure, those kind of individuals have problems in these areas, and it's because of circulation problems, and we need to fix diets. We got to fix on getting the blood flow corrected to some extent, and not just being dependent on a pill.
Well, you have circulatory pathway problems, but also circulatory pathways and biochemical attraction, if you will, is impeded by something, and we go back to our old friend, inflammatory pathway inhibition or excitement.
Right.
And so what you end up with is, let's talk about too much inflammation in the body. Let's say that you're producing enough testosterone, and you do the blood work, and your doctor says everything's fine.
Right.
Why isn't it working? Why isn't it getting into the structure? It's because of this barrier that's being developed in the tissue, so it stops the transport, if you will, of male hormone called testosterone.
Right, and I think one of the things that happens when you talk about inflammation, let's talk about the aspect of what happens is that an inflammatory marker, if the body's inflamed to some extent, one of the biggest inflammatory is actually fat cells, actually obesity. That's one of the number one type things. And when you have that kind of inflammation and you start building additional weight around that midsection, what you're going to do is you're going to start converting some of your testosterone into estrogen. So you got inflammatory blockers, and you also got things that are accelerating or changing how much testosterone's in the system and shifting a biochemical aspect to female hormones.
Guys are going to sit there and tell you, Doc, listen, I'm not fat. How come I have the problem? Well, there's this called skinny fat person.
Right.
You know, and what I mean by that is people who are fat on the inside but look thin on the outside is because they don't have any muscle mass to them, and what weight they do have is mostly fat. 888-630-9625. That's 888-630-WMAL. My guest in studio, Dr. Scott Lamp. Dr. Lamp will be your presenter, your host, this Wednesday evening, November the 7th, at the Roselle Center for Healing. He's going to be talking about male menopause, also known as andropause. If you're having problems, guys, this class is for you specifically. Ladies, if you know your husband's having problems and he's not willing to admit it, drag his butt in here and let us talk to him and give him some simple things that he can do to begin to remedy the solution without becoming grumpy and nasty and ugly and having to take medication for the rest of his life. There's a way around this, and you need to know what it is. Give us a call, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Scott Lamp's presentation this Wednesday, November the 7th. Let's talk about that linkage again. We've got about a minute before we have to take a break. Let's talk about that inflammatory pathway problem. 2-3 things very quickly, and we'll explore those a little bit more when we come back, that set that stage.
Well, I think when you're talking about things that causes aspects, I think one is stress can actually increase that. There's a stress mechanism that plays a part in that. There's also your dietary, your carbs, your sweet cravings. That's another element that's very, very strong with that. And also, there's deficiencies also that are there. Zinc and essential fatty acids are things that play a part with pushing things in the wrong direction. Well,
interesting thing about zinc, when I was in school before I graduated, I had to do a thesis in nutrition for the classes I was taking, and I wrote up about zinc in the prostate gland. And very simply, that 50% of the dry weight of the prostate is zinc. And when that is depleted because of stress over a period of time, then all kinds of hormones don't work. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're at 888-630-9625. That's 888-630-WMAL. Love to talk to you. Any subject you have in mind, let's see if we can help you look in a different direction and fix things without drugs, without surgery. That's why we're here. That's why we do the program every Sunday at 12 noon live, because I hate doing it pre-recorded. My guest in studio, Dr. Scott Lamp. We're talking about a very interesting subject, something that most guys hide from, they don't want to admit to, they don't want to step up to the plate, as you would think. And it's called male menopause, or it's also called andropause. It's the same symptom presentation and more than women going through perimenopause and menopause. It's the hot flashes, the crankiness, the lack of drive, the inability, the low libido, the equipment failure, all of those things. And there's actually a way out of the hole. And this Wednesday evening, Dr. Scott Lamp will be your presenter, your host at the Roselle Center for Healing, and he's going to be talking about that subject, male menopause. So join us, 703-698-7117, 703-698-7117. That's how you register for that event. And tell our staff that you want to be there. That's all you got to do. Before we get started, I want to remind all of you that coming up November the 27th at 8 p.m., WIDA, local PBS, local public broadcasting, is doing a 90-minute documentary on our work, Ageless Health. So put that date down and make sure you're there and watch, and you'll see some of the most miraculous results that we get with integrative therapies. November the 27th on WIDA at 8 p.m. If you'd like to see the trailer, go to our website. Go to rosellecare.com or go to drtomroselle.com. Both of them have the trailer. Go to Ageless Health Premiere, and you can see the trailer. Dr. Scott, in a few minutes, let's talk a little bit more about this biochemical pathway situation. Guys go through it, and we talked a little bit about they go through it for a lot of reasons. Stress, number one. Right. Injury is another one. But also dietary considerations. We eat garbage today.
All the time.
Sugar, sodas, coffee, teas, fast food, fried foods, junk. And it makes a huge difference in our body. How does it affect this? Why?
Well, I think one of the things that happens is that the sugar handling aspect of the body, and we talked about that before. I mean, you get so much input. We get so much of, let's say, just like to talk about sugars, that come in, the body gets overwhelmed by it, and it has to make a compensation to that. Okay, well, if I got too much into it, I can't use it up all for my body at that particular time. I got to store it. I got to put it into things like fat. And when you do that, there's consequences to that over a period of time, because when you start storing things as fat, there's something called the aromatase pathway that starts converting some of the fat itself almost acts like an inflammatory element, and then it actually starts putting pressure on the system to actually shift some of your male hormones, as testosterones, into things like estradiol. Over a period of time can be not a good thing, not heart healthy. It starts changing your libido. There's a lot of things that help with that. Also, additionally, we got things like we talked about before, essential fatty acids, zinc. You were talking about 50% of the dry weight of prostate is zinc elements. Even your old remedies with pumpkin seeds, which used to use,
they work very well.
It worked very, very well. Plus, also the other trace minerals that are with that help us not going from testosterone. There's another thing called DHTs, dihydrotestosterone. The real strong ones that actually create problems on our prostate, makes them enlarge, urinary problems, possible cancer, those kind of things. So we've got to watch out what our dietary habits are, and we want to be able to, and we can control those, but we got to look at where do we need to put certain things. We have like a fork in the road. If we don't have that, when we come to that fork, if we don't have the things that kind of push us to go in one direction, the body is going to compensate and go in another direction, which we might not like.
Well, when we come back after the news, I want to talk a little bit more about how stress patterns affect this, and dietary and emotional stress patterns, because it has a direct effect on that stress hormone called cortisol and the formation of DHEA. But before we do that, I'd like to go to the phones. Rusty, how can I help you, sir? Thank you for calling.
Yes, sir. Good afternoon, gentlemen.
Good afternoon.
I was 47 years old when I had my prostate out due to prostate cancer, and so since that time, I did go through having night sweats, and I went to the doctors, and nobody seemed to be able to tell me what was going on. And I heard your comment about the zinc levels. So having my prostate out, does that have a big effect on me?
It will have an effect, and sometimes just because of the surgery, you're going to have equipment failure because they snip the nerves, and that's one of the side effects, unfortunately. But the other things that we're talking about, I mean, we'd have to look at it as a whole and see really what is taking place. But you look at adrenal fight-flight cortisol level as it combines with DHEA to produce testosterone, estrogens, progesterones. We have to find out how high your estrogen levels are, because for you to have got prostate cancer at that age, my guess, without knowing you totally, is that your estrogen levels were high and you didn't have enough progesterone to blunt the effect, just like a woman. The breast tissue and the prostate tissue are genetically identical. So the things that are going to affect the breast are going to also affect the prostate. And so you would look at that. You look at the inflammatory pathways that we've been talking about, and if there was enough testosterone at one point and it couldn't get into the system, then things are going to happen. Prostate's going to swell. So you look at multi-level pieces. The aromatase pathways that Dr. Lamp was talking about are critical, because if they were too high, then you're going to predisposed to cancers, and there's things that you can do dietarily and so forth. Rusty, I want to touch upon this just a little bit more, so we've got to take a break for news. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio. 888-630-9625. 888-630-WMAL. That's how you find us. That's how you talk to us today. And if you'd like to get a hold of us off the air, you just go to rosellecare.com, ROSELLECARE.com, and send us a note, and we'll get back to you. We'll answer your questions, and we try to do that as quickly as we possibly can. This Wednesday evening, the 7th of November, 7:30 p.m., at the Roselle Center for Healing, Dr. Scott Lamp will be your presenter, your host. He's going to be talking about male menopause, known as andropause. So, guys, this is an opportunity to figure out how to fix it. Dr. Scott is in studio today with me. We're talking about that subject and why it happens and why things go defunct. And unfortunately, in way too many situations today, that's the case. We've got a guy on the line that I'm holding on to. Rusty, are you still there?
Yes, sir.
Thank you, buddy. Listen, so here's the deal. To recap a little bit, when you have prostate cancer at your age, at 47, I think you said, and you're going through the menopausal shift of the sweats and the lack of drive and so forth. Basically, what you're dealing with is this: the trauma of the surgery. Number one is the stress to the body. Number two, the things that brought you to that place in time was already creating the environment. Your adrenal system was not being able to handle inflammatory development in the body, so any estrogens that you were exposed to, environmentally particularly, we called them xenoestrogens, or estrogens from outside the body. Electromagnetics, pollutions, additives, preservatives, the junk they put in our foods today, all those things have an effect. So because the tissue is receptor site sensitive, just like the breast tissue is, we have increased problems today in men. By the way, men are getting breast cancers as well, but in this particular situation. So let me ask you some clarifying questions. What type of follow-up did they do? Did they just remove the prostate? Did they do radiation? Did they do chemotherapy? What took place?
Yes, fortunately, I just had the radical prostatectomy, so I've been cancer-free for about 7 years. Now, in the past year, and I suffer from all the classic symptoms you discussed.
Uh-huh.
My back, I had an injury to my back when I was very young, and so it definitely plays a part in that also. But the main thing is that I seem to have a lot of drive, but in this past year, my blood pressure had been getting to that, it seemed to be on the borderline, about 130/95 for about the last couple of years. So finally it kind of went haywire, and I'm on the lowest dosage of blood pressure medicine at this point, and I definitely can see a difference now because I take the penile injections, which were working great, but they are not as strong now.
No, it's because the blood pressure medication is doing it now.
Yeah, so I have to watch when I take when to still have a normal life.
All right.
So,
well, let's Dr. Scott and I give you a couple clues on this thing. First of all, the stress patterns, the inflammatory pathway problems that are causing the fact that you can get an erection with injections or by other means, or at least could up until the time that you took the blood pressure medication, indicates that your receptor sites are still available, but you're not producing hormone in the way that you should. Now, the prostate is not the deal. It's the the testicles being stimulated by something called LH, which is produced by the pituitary. LH is luteinizing hormone, and that's what causes the thing. But you have to have an intact functioning adrenal system because of something we call HPA axis, hypothalamus, pituitary, adrenal. So we wouldn't know that without a couple very simple tests. But having said that, and we've got to go on, and I'm going to give you just a couple guidelines. You want to change your dietary patterns as alkaline as you possibly can. Increase the zinc. If you use it, use zinc sulfate. There are many different types of zinc, but you want to use zinc sulfate. You want to take about 50 milligrams of zinc 3 times a day. Now, things I'm telling you are not going to hurt you in any way, and they're kind of across the board. Are they going to be an absolute, yes, it's going to work? Not necessarily, but at least you can try these things. If you have
I'm sorry, and I just want to ask real quick. I'm allergic to sulfa drugs. Does that make a difference?
No. It's sulfate and sulfa relative to what you're talking about are two different elements completely. Okay. Magnesium aspartate can help decrease your blood pressure, particularly when your diastolic, which is that lower pressure, is elevated. Your top pressure at 130 is no big deal, but your diastolic pressure, which is the residual pressure that remains in the arteries after your heart contracts, is. And you don't want it that high. You need to get it down naturally at a lower level. But there's a lot that can be done, Rusty, and I invite you, attend Dr. Scott's presentation on this Wednesday evening at our office. There's no cost to it. It's just we require a reservation. Call our office, and Dr. Scott will spend some time and talk to you afterwards, one-on-one. There may be some resolution.
Great. Thank you very much, sir.
Rusty, appreciate it. Thank you for your call. So, Dr. Scott, with cases like this is very typical. Unfortunately, it's surgically induced as well as, but going into it, there was a predisposition. There was something that led up to this situation. Trauma, surgical trauma, emotional trauma, biochemical trauma, trauma are all things that affect the body and cause stresses.
And they're all stresses, too, because, again, stress is going to play a major component to this and drives those systems. And also there's a pathway that we talk about that, again, you got to think about what stress is happening here. Stress means I get attacked by the tiger. I need to run out of the house. I need to get away from that being. At that particular time, the body's saying, I don't need to be worrying about making male hormone at that time. I need to be getting away from the danger. So what happens is the body starts stealing resources from one source to feed another one so I can get away from danger. The problem is your perceived danger. It's no longer the tiger. It's now taxes. It's now all this politics and all the things you're looking at. It's all these different things that's driving it. If you can't get the body to relax down a bit, you're going to keep on stealing away resources for this, especially the area of testosterone. And so what happens is now all of a sudden you're going to start slowly eating away from this, and we start getting these type of symptoms we start seeing.
Even in physiological development, exercise, if you want to create a muscle, you don't hammer at the muscle every day.
Right.
You stress it, because stress is growth. We need to have stress, but then you give it several days in between before you go back to it. You allow it to rehab. You allow it to get the nutrition it needs. You allow it to be calm. So the whole idea of stimulation today, we have to embrace the idea that there's stimulation, relaxation, and if we don't give ourselves the adequate periods of revitalization, structural, chemical, emotional, we got a problem.
I think the term is balance.
Yes.
I mean, and that comes down to is stress in what we eat. I mean, not stress when we eat, but balancing the proper type of foods we have. Once in a while we can get off the beaten track, but not, don't eat crap 90-80% of the time. Maybe you're supposed to be eating well 90% of the time. And there's a balance there. The body can deal with that. That's how the stress handles that. But if you're doing it all the time, those stress mechanisms are now taken out, and you're going down, like I keep on talking about pathways. And in one pathway you want towards health, another pathway is going to take you into a direction of disaster.
It is. It's a shipwreck, and we just don't know, where it's going to sink, but it's going to sink. And it's going to submerge, and then trying to bail it out afterwards is like, you've got to get the balloons, and you've got a long time, and you've got to get the cranes, and it's, where right now you can fix it.
We were talking about the same thing with, we were talking about sugar, like diabetes. Why diabetic people usually have a lot of problems with, their more male hormone tissue, because that's a stress. The sugar handling stress of the body has been compromised. And so when you deal with things like the adrenal gland, it puts sugar in the system, tries to help balance it. So that's another pull away from the proper pathway to create the testosterone. So It's, again, you can have imbalances in structure. We talked about that earlier, and pressures on the body in regards to the nerve not functioning correctly. The emotional, we just talked about, the chemical side. All those have to be looked at in regards to the overall view of the person. And you are unique. Everybody comes in with a different aspect. I mean, we didn't even get into some of the environmental exposure. Cadmium, for example, is a big one in regards to this area. It's one of the heavy metal toxicities that can create a lot of problems.
Absolutely. Cadmium and also arsenic.
Right.
And we have those around us virtually everywhere.
Right.
And the more susceptibility, the more that locks into our brains, the more it causes the neurological pathways not to fire. And in this particular situation, that's what we're dealing with. And what you also see is when you're in a high level of stress from any source whatsoever, it's like you're going, and then all of a sudden you stop. That's when the body crashes.
Hits the wall.
It hits the wall. It's done. And the repair process to get through that is long-term, and you have to start putting together. So you need to protect these things. We're coming down with environmentally maladapted diseases, dysfunctions, disorders today that are highly preventable.
Yeah, we've got over 100,000 chemicals exposures we have to. Everything's trace we will look at, and it's okay if it's trace. Well, these things add up. We don't have no idea about how much they're going to block certain things in our bodies, and I think we're eventually seeing sicker and sicker people. You see that all the time in the clinic. We both do. They're just getting worse and worse and worse, and it's a combination of stress, and I think some of the things, I always start to look at sometimes technology. We're 24/7 now with the cell phones and the iPhones that we have. We're always supposed to be able to do there. If you can't beat out your competitor, you got to be able to be on time all the time. People don't sleep, which is another inflammatory problem that's there. So there's a lot of things that are there that in our society we got to stop back and say, how can we get balance back in?
It's difficult. People come into our office and they're sitting there with laptops or they're sitting there with their iPhones, and they have them in their lap, right? And they're sitting there with these laptops in their lap.
Right.
Well, guess what happens? Their gonads are getting
EMFs.
fried.
Yeah.
They're getting destroyed. And just that type of thing. And we're being exposed to electromagnetic radiation constantly. And all of these things, is an ongoing bombardment, that we're having trouble recuperating from.
Now, one of the good things I can just announce on the radio is one of the things, if you have your cell phone on in your pocket, what are they close to?
That's right.
And I think is when you think about EMFs, just a electromagnetic field, we should be able to tolerate about 1 milligauss. So you have that phone next to your head, you've got up to 20, 25 milligauss that's coming through. And then when you get these new iPhones and they have stronger batteries, they're even more than that.
This Wednesday evening, Dr. Scott Lamp will be your host, your presenter at the Roselle Center for Healing. He's going to be talking about male menopause. This is an opportunity to find out how to prevent and fix things before they do you in completely. Give us a call, 703-698-7117. That's 703-698-7117. Let's go to the phones. Sheila, how can I help you?
Yes, thank you. I've recently been diagnosed with colitis.
Ulcerative or mucus?
Yeah. And
Which one?
In the past, I've had an ablation for atrial fibrillation. All right. And I'm off the medication of the Toprol.
Sheila,
right. But I was told, I was told to take a baby aspirin. All right. With the colitis, I'm told not to take a baby aspirin. Stay away from milk products. And I'm wondering, is yogurt good? Is the almond milk good?
Sheila, hang on a second. I got to ask you a question. First of all, you got to differentiate the colitis for me. Is it an ulcerative colitis or is it a mucus colitis? So you're bleeding.
Yes, it's on my I haven't had any bleeding.
Okay, then it's not ulcerative. If it's ulcerative, you're bleeding all the time. If it's not, you probably have mucus colitis or you have irritable bowel syndrome. I've got about a minute. Are you having intestinal tract cramping and that sort of thing?
Occasionally, yes.
Okay, how about diarrhea?
Yes.
Okay, all the time or occasionally?
Pretty often.
Okay, through the day, 4, 5, 6, 10, 12, 13 times a day?
Oh, no, nothing like that.
Okay, you probably don't have colitis because you're not fitting the definition. You may have an irritable bowel problem, and that's a whole different situation. I would have to know a lot more about your case. However, dairy, if you're allergic to it or you have any sensitivity to it, also gluten. Any product that has gluten in is going to be deadly to you. You need to stay away from gluten. You need to stay away from dairy products. You need to make sure you cook your vegetables, juicing vegetables. You need to stay away from anything that has my mantra: sugars, sodas, coffee, teas, fast food, fried foods, alcohol, gluten additives, preservatives. All those things are going to make you much worse. George's Aloe Juice, on top of everything else I told you, will help. 2 ounces, 3 times a day. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Been broadcasting to you from 105.9 FM and AM 630 WMAL. We're here every Sunday at 12 noon, bringing you the most up-to-date information that we possibly can. We can always be reached off the air at rosellecare.com. That's ROSELLECARE.com. We will return your requests for information. Sometimes it takes me a couple days, but I will get back to you. If you need to talk to one of my doctors before that, simply call 703-698-7117. And by the way, that's how you register for Dr. Scott Lamp's presentation this Wednesday at the Roselle Center for Healing. And for those of you who know and those of you who don't, we are located approximately a third of a mile, half a mile at the most, off the National Capital Beltway. You exit onto Route 50, Arlington Boulevard, and we're in the Red Cross building. So give us a call if you'd like to attend. I would encourage you. Dr. Lamp will take as much time as necessary to go through the intimacies, if you will, of this condition, male menopause, and show you guys how to fix it. Ladies, if your husband has been cranky and you want him at a much higher level, this is an opportunity. Grab his butt and take him to this class, and we'll show you how to make it better for, in some cases, both of you. 888-630-WMAL, that's where we are today. Dr. Lamp, this Wednesday evening, let's talk about what it is that you're going to cover.
Well, we're going to talk about all the effects that usually happens to the male as he goes through the process of aging, the menopause element, or the andropause. We're going to look at what blood workup should you be able to get, what kind of saliva testing, so we'll talk about those, and why those are important to take a look at the whole picture. We're going to take a look at some of these herbal elements that are out there, and some of those are good for certain things and others are not. So it's kind of good to take a look at all the different pathways, what's happening with you in regards to your dietary elements. We're going to look at the structural component. We're going to look at the things that we talked about in regards to emotional elements. And we're going to have a little workshop. We're going to have some a little question. I'll give you a little information sheet. You're going to go through and check yourself off and find out where the areas of weakness are for you, and we're going to see what we can do to kind of help you solve some of your problems.
This is a power-packed night. He really is going to get into the down and dirty, and if things are fixable and the nerves haven't been damaged, there's a lot that can be done to get you back functioning at the level that you should, to coin an old commercial that was out there, get you back in the game, but more importantly, to get your head, your drive, your capacity, your thought process where it really needs to be. So if you're an old curmudgeon and you've been grouchy, and old meaning, it could start at 30. In today's world, we're looking at guys, unfortunately, that have the sperm count at age 30 that guys in 1950s had at age 60. It's not okay. We have insult hitting our bodies constantly. So give us a call, 703-698-7117. And I want to remind you again, November the 27th, 8 p.m., Ageless Health, Weeda Production, documentary on our work is going to be aired. You're going to be beyond impressed. We're here every Sunday at 12 noon bringing you the most up-to-date information. Don't forget to join us and tell your friends that we're here. We'll see you next week. This is Dr. Tom Roselle.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.